Avid Australasia, Animal Australia, Medtronic, Novo Nordisk Pharmaceutical, Roche Diagnostics and Scholarrr1.wmv, and the Austin Health for providing me with this scholarship and this fantastic opportunity. Especially, I would like to thank the diabetes educators at the Austin Health for their continued support and encouragement throughout the last 12 months. And I would like to also thank my manager, who's Anne-Marie Momi, she's here today, and for giving me that support and understanding my need, because I was working full-time and doing the course, which was a big challenge. But I did that and I completed that, so I really needed a lot of support from them as well. Now I have successfully completed the course. I've got new challenges away, and this is only the beginning of an exciting journey ahead for my career in diabetes education. So now I'm not giving, it is already a surprise for everyone who got the scholarship this year, so I'm not telling the name of the person, but whoever got the scholarship this year, I'm offering all my support, and anyway, if I can help you in the next 12 months, I will do that. And I'm sure that you will find this as a rewarding experience like me. Thank you.
Thanks, Anita. That was just lovely, and it's lovely for us to hear how you've been able to utilise the information that you've learned and apply it to patient care. So thank you very much. I'd now like to introduce Associate Professor Richard McIsaac, who would, I think, like to say some words about diabetes at Austin. And thank you, Richard.
Thank you very much, Victoria. Well, to start with, I'd like to personally welcome the members of the Baker family that are here, the extended members of the family, and all the staff from Austin Health that are here today for this special occasion. Obesity, industrialisation and an ageing population have all combined to dramatically increase the prevalence of diabetes throughout the world. And I'm sure most of you are aware of this fact. We really can't go past for a week or a few weeks without reading something in the popular press about this increasing prevalence of diabetes. This increasing prevalence of diabetes is a major public health problem, not only because of the increased cost that will go along with the day-to-day care of people with diabetes, the cost of scripts, cost of medication for insulin, but also because of the increasing cost of the associated with healing disease. If you go around to the dialysis unit here at Austin Health and ask people why they're here, but we tell you it's because diabetes is to failure of my kidneys. If you've got diabetes, you're at a 2 to 4-fold increase of having a heart attack. That's even up compared to people without diabetes, and that's even after adjusting for all the other risk factors associated with heart disease, such as high blood pressure and high cholesterol levels. Diabetes is the leading cause of lower extremity amputations in the Western world, and it's also the leading cause of...
To make a further acknowledgement, and that's to the diabetes educator's boss, Cameron Goodyear, who's sitting in the front, because Cameron, I just want to say thank you on behalf of the educators for the support you've given us and in certainly increasing our services, and we very much appreciate that, and I think again that certainly benefits all people at Austin with diabetes, so thank you. Well, good news, and we want to announce the winner. So I'm going to ask Richard to present the winning certificate, and I'm just going to tell you a little bit about our winner. So it's with great pleasure I introduce the 2010 Miss Baker Memorial Diabetes Education Certificate Scholarship winner. Her name is Lucy McKenna. Lucy... I'll tell you a little bit about Lucy, and I'm sure she'd like to say a few words shortly. Congratulations, Lucy, first of all. Lucy is a registered nurse from the radiology department of both Austin and Repat campuses and works in the complementary roles of radiology liaison nurse and as an associate nurse unit manager. Lucy has more than 12 years experience as a Division 1 nurse, both in Australia and overseas. She completed her Bachelor of Nursing at the University of Sydney. Her peers and colleagues, and Lucy sees many patients with diabetes in her role and plans to ensure that this scholarship makes an effective difference within the radiology department and Greater Austin Health. please join me again in congratulating Lucy, and I'll ask Richard to present the certificate. And Lucy, if you'd like to come over here with Richard, we'll just cover these. Yes, if you'd like to do that with them. And then we had Tanya Quirk in 2007, Anita Rich in 2009, and Lucy for 2010. So congratulations. And I just thought you might like to thank Richard.
First of all, I'd like to say how honoured I am to receive the award for this year. It's been my ambition since I started my nursing career 12 years ago to do the diabetes education certificate. My interest in diabetes began with my sister's diagnosis of type 1 diabetes at the age of 14. So I grew up with a family dealing with diabetes sort of day to day. And I've seen what impact it's had on her lifestyle. I've also seen how well her diabetes has been managed by her endocrinologist and her diabetes educators, and it's given her the independence and the knowledge to manage her own diabetes effectively and so far complication-free after 25 years. So I began nursing 12 years ago. I started working in Sydney, and then I moved overseas, and I was working in England for 6 years. Then I returned back to Australia. I was working in Sydney for a little while, and I found myself at the hospital now. And I'm working in the radiology department, which is an amazing department that deals with outpatients and inpatients. We see people for CT scans, interventional radiology, and amongst our patients we see many diabetic patients. We treat a lot of patients with renal failure. We also treat registered nurses, so they don't have much knowledge of diabetes, so it would be very beneficial to have a resource in the department. I believe that diabetes is a growing field, and the more people, the more nurses who can do the diabetes education certificate, the better it's going to be for our patients on the ward and in the community. I'd like to say a few thank yous. I'd like to say thank you to Liz Baker's family for attending today and for supporting the scholarship. I'd also like to say thank you to the sponsors for their financial support for the scholarship, so it's allowed it to continue for the past 3 years and hopefully for many more, so that other nurses like me have an opportunity to do the course. I'd like to thank my colleagues in radiology. They really supported me in applying for the scholarship this year, and they also wrote me some really nice references. I know they'll give me a lot of support next year, which is when I'll really need it as I'm working full time. I would like to thank my husband Paul over there, just because he helped me with all the technical issues in terms of the interview. I would like to thank the board members who agreed to do a telephone interview with a time difference of 5.5 hours, and just getting it all sort of set up was quite difficult. I'd like to thank Victoria especially for their dedication in making the interview happen. We tried Skype and it didn't quite work, but we got there in the end with the phone interview. And finally, I'd like to say how much I'm looking forward to doing the diabetes education certificate next year, which I will be doing at Deakin University. And I'm looking forward to improving my knowledge and the professional development that this will give me.
Thank you. That's very wonderful, and we certainly look forward to hearing how your year goes. So thank you for those words. Okay, what we'd like to do now is show our certificates of appreciation or our evidence of appreciation to the industry companies that have been involved, and I'd like to ask Richard to present them as I